And welcome back to this special edition of the Morning Blend with our partners, Jammin 98.3 for Jammin Cares. We're talking about COVID resources and vaccine rollouts today. Seniors and adults with disabilities are among the most vulnerable, so keeping them healthy is important. We're joined by Maria Ledger from My Choice Wisconsin, a managed care organization providing government-funded programs to frail seniors and adults with disabilities. Good morning and welcome to the show, Maria.
Good morning, Tiffany. Thank you for having me.
Absolutely. I'd love to know in your words just a little bit more about how you describe My Choice Wisconsin and what you do.
Basically, we provide services and supports to allow seniors and adults with disabilities to live as independently in the community as possible. We provide programs like family care partnership, Medicaid SSI, Badger Care, and Medicare Dual Advantage.
How many people are you serving currently?
My Choice Wisconsin serves over 41,000 members in 55 counties across Wisconsin.
That's pretty incredible. You know, I think that during the pandemic, keeping people healthy, especially those who are vulnerable, has been a priority for many of us in our families, as well as many programs. So talk a little bit about how you've worked to help keep those who are the most vulnerable in our community healthy during the pandemic.
Sure. My Choice Wisconsin has tried to keep as many services for older adults and persons with disabilities intact as possible. It's been a challenge. As you can imagine, some services haven't been able to be offered in the same way with Safer at Home, but we've tried to be flexible and work with our providers and with our members. We've also tried to keep in contact with our members. We've offered virtual visits, telephonic visits, and but we've always maintained home visits for our most vulnerable members. When there have been emergent situations, we've had home visits that have been done very safely. We do screenings before those visits are conducted. We've offered PPE to our members so that if our enrolled members in the community don't have face masks, or other protective equipment, we've offered it to them. We do screenings before we go out in the community. So we tried to do things as safely as possible. We offered what we called porch visits, so we can visit with people through their front door, through a window. But we try to make sure that we're still contacting people, making sure that they're safe in the community, but that our visits don't present any health risk or danger to them.
You know, one of the things I think about just as you're talking about that is that many of the clients that you work with are very isolated. And that isolation during this past year has been so difficult for so many of us, especially mentally. But then if you're, you know, a senior or someone with disabilities, there's a whole nother added element of that isolation. And then the people who care for you haven't been able to come in. Have you seen that being an issue with many people you work with?
Absolutely, and that's why we've tried to make sure that even when the Safer at Home orders were, strictly enforced, and we wanted to keep people safe, but utilizing technology, making sure that if we could use iPads, if we could have any way to do a virtual visit and make sure that we were checking in on people, that we were helping people contact family members, that we were allowing people to still contact friends and family or interact with peers through virtual visits, that we were doing as much as we could to make sure that we were sort of combating that isolation. We know how important those social connections are, and that we want to make sure that also for our network of providers, that when things began to open up as they are now, thanks to the rollout of the vaccine, that our provider network is still intact for our members to utilize as things begin to open up safely and in a really measured and thoughtful way.
Well, Maria, I'm glad you mentioned some of that, because I think about your employees and the people you're talking about who are serving the people that you work with. How have you been able to keep them safe as well? You know, because obviously to do that means that you stay open to serve those you serve.
Mm-hmm. Yeah, we've been very happy with sort of the low incidence of exposure and with COVID positivity with our own employees. We've got over, or just under, I think, 900 staff, and our positivity rate has been under the statewide rate. We've been very careful. Employees do a self-screen before they do a home visit and before they come into any of our offices. We've been very careful with sanitation practices. We really strictly follow the 3 W's. So wear a mask, wash your hands, and watch your social distancing. We look at capacity when people are in the office. So not as many people in the conference room. In break rooms, our offices are really very sparsely populated. Again, now that the vaccines are rolling out, we're doing a very thoughtful process about how people will come back in. But we've also tried to be very flexible because we have staff that have had to do a lot of juggling with schools being closed and daycare not being open. So we've wanted to make sure that we're as accommodating as possible to staff. But we've also highly encouraged our staff to go out and get the vaccine as soon as it's available, and made it as easy as possible for them to go ahead and do that.
Well, you guys are caretakers to the max, so we appreciate your message today. Thanks for joining us, Maria.
Thank you so much for having me. I really appreciate it.
Absolutely, we do too. And My Choice Wisconsin encourages everyone to get vaccinated when they're eligible if they choose. For more information, visit mychoicewi.org or call the number on your screen as well for more.